No, not at all. And
No.
not if we want to get good outcomes and
Right.
not if you want to have better care, which I think we all do. Government socialism doesn't reach those outcomes. There's always going to be distortions that happen in the marketplace when you have so much government involved. And, with Dr. Dean Waldman, who's my co-author in this book he wrote, Empower Patients, we talk a lot about that. And he's a medical doctor. I'm an economist doctor. And so we came together
My
to
wife
talk
is
about
a physician, so I get this entirely. So go ahead, please.
Yeah, exactly. And so, he came at it from the physician angle saying, look, I have to do all this paperwork. I've got to hire more people instead of what I want to do is just help take care of people. And one of the things that we came up with, Andrew, in looking at a lot of the research out there is that about 50%, up to 50% of the 4.9, say $5 trillion we spend on healthcare is actually not going to care. It goes to bureaucracy, unnecessary sort of procedures, a lot of other things that basically deals with paperwork and bureaucratic bloat. So that's close to $2 trillion that's not going to care. Now, some of it may be needed for some capacity, but I think healthcare should be about getting better care for the patients instead. And our big three things that we think would help to revolutionize healthcare to a more market-based system is, for one, get rid of the employer-sponsored health insurance tax credit that goes to the employer and forces them to buy private health insurance and reduces portability, and instead give it to the workers. Give it to the people to have it of their own capacity to spend it how they want. The other part of this is a no-limit health savings account. Why do we put limits on health savings accounts? If people need more, let them put more in there to go for their care. And then that also gives incentives for them to use it or not, given how much money is in the program. And the other big one here is on block grants to states for Medicaid.
Sure.
And we should get out of this business of the federal matching assistance program, because what that incentivizes is for states to spend more and then bring more federal money down, meaning our taxpayer dollars, and redistributes that money around. And instead, we can use our system of federalism, this laboratory of competition, to see what works and doesn't work by giving states flexibility with those block grants. And I think we could really revolutionize our healthcare system by just doing those three things to get us back on track to bring in more supply. Now, I also agree with you, though, because that's more on the demand side, right? It will influence the supply side. But I also think we should be looking at scope of practice for nurse practitioners. We should be looking at ways that break down a lot of the licensing barriers that 100%. Go in, because that's also really reining in a lot of the supply side.